Good morning, Dianne. I can see you're connecting now.
Hi, can you hear me now?
Yes, we have you here. We have you for 5 minutes, Dianne. I'll hand that time to you now. Thank you.
Thank you. Good morning, everyone. We've been told of the wonders of GE like an ad campaign. Everything is wonderful, and yet you don't want to boldly proclaim a product is genetically engineered or genetically modified in the labels of products. Instead, an unelected, unknown regulator will get to decide what is close enough to nature that it doesn't need regulating, and thus no labeling required. People want food created by nature, not in a lab. That is why food proclaiming no GMO on the label is popular and boldly printed, not hidden by a sleight of hand regulation change as this bill proposes. Yes, we've been changing the food we eat over thousands of years through natural means of cross-pollination and selected breeding. A mule is a cross between a donkey and a horse, but if mules can't create more mules, nature has its limits. Gene technology may be able to overcome this, but should we go down this path? So far, trials to create a hornless cow have failed miserably, with animals suffering cruelly and becoming infertile. Nature has limits, and it's our hubris to think we can do better. We share 98.8% of genes with chimpanzees, but that 1.2% difference has a huge impact. Small changes can have massive effects. Whether our food is organic or conventional, many of our overseas markets do not want GE food. Therefore, this is clearly a matter of national economic importance. Overseas, there has been boycotts of products made from cow's feed with GE feed Bovaer. Reports from farmers that have used this product say their animals suffer, are sick, produce less milk, and don't want the feed, which is also expensive. Yet some will say Bovaer is a success because the cows don't burp so much. Whoopee. The same result can be achieved through feeding ruminants a natural varied diet with plantain, seaweed, and other naturally occurring plants, and not restricting them to a monoculture of ryegrass. Liability is a huge issue, with Lab Technician X or Company X having no liability for what they produce. They're not responsible for accidents, not responsible for cleanup, not responsible for how it affects our economy, health, side effects, unforeseen results, and so on. As long as they meant well, it's okay. They'll be more careful next time. Yeah, right. One of the best safety checks to ensure a good outcome is to make people liable for what they create. If this technology is so wonderful, so safe, with no danger of it escaping and infecting neighboring fields with GE-altered seeds and plants, why is this no liability clause actually necessary? We don't actually know how altered plants will affect birds, bees, and all the insect life we don't think about, but it's vital for plant reproduction, soil health, and in the end, our health. Another troubling aspect of this bill is using 2 overseas regulators to greenlight the use of something in New Zealand. It doesn't say they have to be from different countries, just 2 different regulators. Why reinvent the wheel, I've been told? Well, it all depends on how ethical the wheel is. I wrote about and referenced the latest court case against Merck and their Gardasil vaccine being contaminated with HPV DNA, the very thing it is meant to protect young women from, and that the regulator, the very government body meant to oversee and protect people, was complicit in covering up contamination. How many daughters, sisters, nieces in New Zealand have already been harmed by this corruption? Or maybe they will be next time they receive a booster. This is not an isolated case, and this bill is relying on the integrity of regulators to guarantee the safety of our food supply, our health, and our economy. Regulators in any country are prime targets for corruption, as big pharma, big food, and the agrochemical industry all have very deep pockets and interests in helping government agencies or regulators smooth the compliance process. This bill has needlessly been rushed with no proper cost-benefit analysis or thinking through all the consequences. Government is meant to do the will of the people. This is a coalition government, and despite your coalition agreement, it doesn't have the mandate from the people to push this through. The majority of the people don't want to have gene technology laws liberalized. Thank you.
Thank you, Dianne.
Oh, sorry, I forgot to put my video on.
That's okay. You've got 10 seconds. You can do it. No, but that was a valuable presentation, a passionate presentation. Thank you for presenting to the committee this morning.
Right.
Have a good day.
Thank you. Bye.
Bye. All right. Next up, we have.
Gee, there seems to be never quite get enough time to get questions.
I know. Well, and you know, you have to go as fast as you possibly can to fit it in. I mean, the whole thing, you've got 5 minutes, and we were told it was going to be very, very, strict about time.
Yes.
Because there were a lot of submissions, but I mean, they're only hearing 400 of the 900 people who said that they would submit.
So it sounds
orally submit.
That sounds very similar to the Treaty Principles Bill.
Well, yes, they learnt how to fiddle things then and applied it to us as well, yeah.
Yeah, no, the next one I think it's going to be on is the 4-year parliamentary term.
Yeah, well, funnily enough, I think that that's a good idea to have a 4-year parliamentary term, because the MPs have 1 year to get used to the job, 2 years to do it, and 1 year to electioneer. At the moment, they only have 1 year to do the job. Anyway.
Yeah, it's funny you mentioned that, because when I worked for BP, the standard progression system for when you move up the ranks in the company is that you are meant to wait 2 years in a position in a senior management position before you move up the ranks. So say if you become a cafe team lead, which is what the highest position I got before I left, I would have to be in that role for 2 years before I could apply to become a store manager, which that makes sense. But I do know there were situations where people, jump the chain a bit quicker than what it would normally be.
Well, I think our Prime Minister did that.
Yes, yeah, you actually are right. I mean, he is probably the first Prime Minister who hadn't even done one term in Parliament, and he is in the top job.
And actually, most of the national MPs are pretty inexperienced. You've got about fewer than a handful that actually have been in Parliament for any length of time, or actually have, sort of know much about what they're doing. I mean, you've got obviously David Seymour and Winston Peters, but we'll forget them. Yes, it's. I think they do need longer in office to be able to learn the job. I mean, looking at Damien O'Connor this morning on the Q&A, I mean, he really knows what he's talking about.
Yeah,
he's confident. I didn't agree entirely because I'm more of a pacifist than him, but generally, I thought what he said was pretty sensible. And I thought, now, why can't we have somebody like that in Parliament instead of a bunch of people that really don't know what they're doing? But anyway, going back to Dianne Downward, do you want me to make a comment?
Yeah, make some comments, yes.
Well, she mentioned about the regulator, because this bill has a regulator, or they'll have two regulators. Or is it? No, only one regulator, sorry. I mean, corruption can creep in so easily. I mean, we're already in New Zealand, in Parliament, we have lobbyists coming in all the time. We have some of the most lax lobbying laws in the world, really. And so, you could have corruption. And what else was I going to say about that?
And the authorities don't even have to be New Zealand. So we could have the FDA of the United States doing it, which historically was known as a well-reputable source, but has become a lot more questionable in more recent times. And do we really want something that got greenlit by the US FDA that actually is making the decision on there, considering some of the decisions that come from the FDA now, we just literally go like, a what?
Yeah, no, that was exactly what I wanted to say, was that the regulators don't have to come from New Zealand. I mean, not the regulators, the regulations. If they say, well, is this genetically modified crop safe? And two people from overseas put their hands up and say, yes, it's totally safe. So little old New Zealand will just say, okay, well, we'll have it then, because they probably know better than us. Well, I don't know about that. Anyway.
Yeah, I love what Soraya has put in here was no antitrust. We've got, which is probably no antitrust laws.
Yes.
Yeah, which is true. It's like how we ended up with a duopoly for our supermarkets.
Yes.
Yeah.
So, and the other thing was, Dianne pointed out the difference between humans and chimpanzees being absolutely minimal, just a few genes, and yet it makes quite a lot of difference. I mean, I'd have to shave my arms all the time if I was. No, seriously. I mean, we are quite different from chimpanzees. So, you change the genes of something, and she's both Elvira and Dianne have mentioned about animals and the suffering and the awful things that happen when they genetically modify animals. So, that was mainly what I was.
Thanks for watching. Make sure you're subscribed to our Facebook.